Let's chat Botox. Some love to do it, others have never tried it before, but there's no doubt about it. Botox is a hot topic in popular culture, so we're going to talk about all things Botox or no tox. Here to debunk some of the most common Botox myth, you know him, you love him. TikTok famous plastic surgeon Dr. Anthony Youn returns to the show. How are you?
Great. Thank you so much for having me back on.
It's been a minute, but what I love about you is you refer to yourself as the holistic doctor because you say all plastic surgery should be last resort, which is unusual coming from a plastic surgeon, right?
Yeah, I mean, it's so important because if somebody ever asks me, if I go under the knife, what's the worst thing that can happen? We always have to start out with death.
Yeah.
And so we go from there. And so, yeah, if we can get you looking the way you want to and get you happy with your appearance without going under the knife, it's totally the way to go.
And we're both big believers in clean beauty. That being said, I have never had Botox, and some of these myths are ones I've heard about, so let's see if they're true or false. First up, Botox is dangerous.
Yeah, no, it is true that Botox is one of the most potent toxins or poisons in the world. However, when we do Botox, and as long as it's not black market or something crazy like that, it's injected in such tiny quantities that it is very, very safe to have done. I mean, it really is the most popular cosmetics procedure in the history of the world. You know, I tell you, in my practice, we've done thousands and thousands of these treatments and have never had a real complication.
Okay, but there can be some, right?
Yeah, usually the complications that you can get are more minor, like a droopy eyebrow, worst case scenario, droopy eyelid. Once again, as long as it's performed with trained hands, it's not black market or something like that, it is a very safe procedure.
Okay, next myth. Wrinkles get worse after you stop because people say like a balloon, as you don't make the collagen, that if you're filling it up with Botox, that when it deflates, it makes that wrinkle deeper. True or false?
So that is false. So Botox actually is a neurotoxin that prevents muscles from contracting for about 3 to 4 months. And so there is this belief that if you stop doing it, maybe your wrinkles are going to get worse afterwards. If anything, actually, they may get a little bit better because sometimes those muscles will atrophy, they'll get smaller, and they're not quite as apt to creating lines.
3, Botox makes your cheeks look too puffy.
So this is actually completely false because people get Botox and filler mixed up. Filler basically is something that adds volume. And so if you inject a bunch of filler into your cheeks, it can make your cheeks look puffy, but Botox won't do that at all. It doesn't add volume like filler.
Okay, number 4, if you do opt for surgery, Botox isn't necessary anymore. True or false, Doc?
That is false because surgery and Botox do two very different things. If you have a facelift, it lifts what is sagging. If you have Botox, it smooths lines. They're two very, very different things.
And number 5, Botox makes you look surprised all the time.
That can be true if it's done inappropriately, especially if you've got a very active eyebrows and they do it a certain way, you can make your eyebrows look more elevated and more surprised. But as long as it's performed in the right fashion, in the right places, it's very unlikely for that to happen.
Okay, Doc, cost and maintenance, what are you looking at? Because it can add up, right?
Yeah, the average cost is anywhere from about $500 to $700, and you've got to consider it lasts about 3 to 4 months. So most people have it done about 2 to 3 times a year.
Okay. Now, if you look at, we mentioned pop culture, the Kim Kardashians of the world, and even Victoria Beckham, Posh Spice, they refuse to smile because they say it'll contribute to more lines. Is that a thing?
That technically is true. You know, we all have friends of ours who are really dynamic. Their faces are super dynamic. You can get more wrinkles if you do a lot of those types of kind of extreme facial expressions. And so Botox does the opposite of that. It prevents your face from creating a lot of those extreme expressions, and that can help smooth the lines.
We're hearing about some green versions when it comes to Botox. Have you seen any of those? Are they as effective? What's your take?
So there's nothing that works quite the same as Botox. There has been a product that was a topical version of Botox that was in the FDA approval pipeline here in the United States. And since then, it's actually been taken off. I do think that there is a future for that at some point. They just have to have the delivery mechanism where you can actually get that Botox substance through the skin and into the muscles where it needs to go.
Now, you also hear about preventative Botox where people do start as young as in their 20s and 30s. Does that work if you start younger, or is it like a moot point when you're that young and you still have so much collagen that you're naturally making and building?
Yeah, it can work. The problem with prophylactic Botox, my feeling is that it is a medical procedure. If you have it done that way, The concern is that when you really need the Botox and you're in your 40s and your 50s, you may have antibodies to it and it may just not work as well.
Ah, very great knowledge as always. Check out Dr. Youn. He's a huge star on TikTok, Instagram, YouTube. Make sure you follow him at Tony Youn or on his website, dryoun.com. Nice to see you.
Thank you so much.
Take care. That was a great talks.